Very good evening. We have Dr. Krishna Chaitanya sir with us, the lead consultant in vascular endovascular surgery, Aster CM and Aster RV Hospital with us. So I would like to start off by asking him the basics of DVT. So, sir, what exactly would the symptoms and signs be if a patient has DVT?
Good evening, Dr. Pavan. Uh, uh, Deep vein thrombosis is a condition where the blood flowing from your feet to the heart tends to get blocked, especially in your legs. The broader terminology currently used today is VT, which is venous thromboembolic disorders. So DVT, as when we say deep vein thrombosis, predominantly affects the legs because the deep veins are of the legs, but it can affect even the pelvic veins. The clot can affect the lungs also. So when we talk about deep vein thrombosis, the first symptom which the patient usually feels is feeling of pain and swelling in the legs. The swelling might be trivial, but noticeably when the patient tries to walk, the pain increases. Unlike any other conditions, the moment the patient puts the foot down and walks first few steps, the pain will be described as bursting type of pain or where the patient feels extreme heaviness in his legs. Sometimes this might be also associated with redness of the limb, shininess of the skin, and there might also be a mild fever associated with deep vein thrombosis. If the patient, along with the symptoms, experiences difficulty in breathing, cough, or chest pain, it may be more likely that the clot might have dislodged to the lungs, what we call as pulmonary embolism. So, pain, swelling, with or without redness of your legs is one of the very important way a DVT should be looked at.
So, and are there any particular risk factors which will predispose to DVT in these patients?
DVT can pretty much affect anybody, more so people who might have some underlying clotting disorders. When we see young patients, those within 45 years, those with a family history of clotting disorders, or without any reason, if they notice a leg swelling, the clot, it is usually the genetical factors, which are what we call as thrombophilia or hypercoagulable states, where these patients are affected. Other than this, elderly people may be more prone to develop deep vein thrombosis or venous thromboembolic disorders. Patients who are undergoing surgeries, more so surgeries related to abdomen, pelvis, orthopedic surgeries, surgeries of the knee, where they do knee replacement surgeries, hip replacement surgeries, surgeries associated with malignancies, the cancers, bariatric surgeries, surgeries in obese individuals, patients who are admitted to critical care units, the ICU with infection, the sepsis. These are particular subset of patients in whom there can be a strong reason to develop venous thromboembolic disorders and specifically deep vein thrombosis, because most of these patients are immobile during their procedures. So there is slowing down of blood along with the inflammation which sets in with the surgery and the critical illness, which might predispose these patients to develop venous thromboembolism. Another important factor is trauma. When patients have trauma or accidents or injuries, they have their leg immobilized due to plaster cast or due to direct injury to the vein. These subset of patients may also develop deep vein thrombosis.
What are the complications that we find, sir, after the patient has had DVT?
See, the natural flow of blood in the veins is towards the heart and the lungs. Heart and the lungs work as one functional unit, where heart is the pumping organ, while the lungs are the gas filtering organ, which filters the oxygen and the carbon dioxide, which behaves like a sieve. Now, the direction of blood flow from the leg towards heart and the lung is below upwards. So when the blood clots, the fresh blood is gelatinous or a jelly-like consistency, and it can be easily dislodged by vigorous movement of legs or massages or by squatting or any such movements. So, one of the dreaded complications of deep vein thrombosis is the clot migrating towards heart or the lung, where it can choke the filtering mechanism, and patients might develop what is called as pulmonary embolism. If the clot burden is more, that means if a big amount of clot goes and lodges in the lung, it can even be fatal, where the oxygen supply to the bloodstream can be cut off due to significant portion of the lung getting clogged by these clots, and patient might have severe breathlessness. So this is one of the dreaded complications of deep vein thrombosis. Even if a patient does not develop pulmonary embolism, an unrecognized DVT can lead to long-term consequences, which we call as post-thrombotic syndrome. Now, what is this post-thrombotic syndrome? Is patients with clots in the legs, which are not properly diagnosed or not properly treated, might land up with this particular condition where the clot permanently clog the deep veins, which leads to leg swelling, progressive blackish discoloration of the legs, itching sensation near the ankles, and sometimes even formation of wound or weeping ulcers, which fail to heal even after several attempts at healing. Now, this particular condition called post-thrombotic sequelae may not have a proper treatment even till date. So, proper treatment, recognition of deep vein thrombosis, and appropriate initiation of treatment therapy is very important to avoid this long-term consequence also.
And what would be our ideal way to manage DVT, sir, both in the acute and in the chronic phase?
In an acute phase of deep vein thrombosis, patients, the first line of treatment is always what we call as anticoagulation. We have to thin the blood. We have to limit the clot formation. Our body itself has a limited ability to dissolve the clots. However, if the clot burden keeps piling up, our body fails to dissolve this clot. So the first treatment that we have to institute is what is called as anticoagulation. In common language, what we might call as a blood thinner treatment. Now, there are several blood thinners which are available. The earliest form of blood thinner was injectable blood thinner called as heparin, which used to be given in a form of infusion with timely monitoring. Now, that molecule was not very specific for the clot. So, subsequently, there were development of lower molecular weight heparins, which we call as we have the enoxaparin, we have the dalteparin, we have fondaparin. But most often, the deep vein thrombosis requires treatment over a few months and sometimes even many years, depending on what is actually causing the deep vein thrombosis. So, because taking injections for such long duration may not be feasible, or patient might not be compliant with the treatment, and because treatment is very important, there has been development of molecules which are called as novel oral anticoagulation tablets, also called as directly acting oral anticoagulation tablets. Now, where these same blood thinners are being given in the tablet form, where patient compliance is better, adherence to treatment is better, and even the results are better. More so, these tablets do not interact with much of foods which were there with the previous generation of tablets. So the patient acceptance is better.
Thank you so much, sir. That was very insightful and precise.
Thank you,
Thank you.
Pavan.